learning how to manage your neobladder at home. You will be using these instructions immediately following your surgery and for the next 2 to 4 weeks afterwards. You will learn about the catheters that you have and when to call for concerns. After your surgery, your new bladder will be healing. A tube called a Foley catheter will drain the urine from your new bladder into a leg bag or a bedside bag. This may be your only catheter. Others may have a second tube. This is called a suprapubic tube, and this may enter into your abdomen, into your new bladder, and it is also connected to a leg bag or overnight bag. It's common to have some redness around this tube, as well as some green crusting. If the redness is spreading or you have a fever of 101.5 or greater, please contact your doctor's office or show it to your home health care nurse. It's rare for these tubes to get infected. You will use the leg bags during the day and the larger bags when you sleep at night. The catheters are left in place for about 2 to 3 weeks after you discharge from the hospital. The intestine is used to make your new bladder, and it does produce mucus. This is completely normal. It does not mean you have an infection. You will need to keep the inside of the catheter tube clear to prevent mucus from blocking the flow of the urine through your tube. This is called irrigating the catheter. You will need to irrigate every morning and evening before bedtime. You may need to irrigate more often if the tubes are not draining well or becoming blocked. My thoughts are, if you're in doubt, go ahead and flush the tube. The catheter is blocked when you notice urine leakage around the catheters instead of into the urinary bags, or a decrease in the amount of urine from normal. Irrigating is really important for several reasons. If urine backs up into your kidneys, it can cause an infection or possibly kidney failure that may be permanent. You will need an extra set of hands in the beginning, but it will get easier with time. You will want to irrigate your catheters in the bathroom or over a non-carpeted surface. You can position yourself either in a chair or over a toilet or even in the bathtub in case there is a spill. You will need the following items. You're going to need a large syringe, normal saline or sterile water, 2 graduated cylinders, and a catheter plug. You always want to wash your hands before you do the irrigation. You want to gather all your supplies. You'll pour in your fluid. And you'll want to go ahead and draw up between 40 and 60 mils of fluid. You'll take all your supplies to where you're going to be to do the flushing. Okay. If you have a suprapubic tube, you're going to want to clamp one of the tubes. So you'll unattach the tube and you'll plug it. If you don't plug it, when you flush the other tube, it's just going to flow back through this other tube and it's not actually going to flush your bladder. So next, you're going to want to start flushing. You're going to unattach from the bag. So you're going to take the solution, you're going to attach it to the catheter, and then you're going to gently flush in. You should flush in about 40 to 60 mils. What you're going to want to do next is try to pull back on the syringe to try to aspirate back mucus that might be in your bladder. You may meet some resistance and you may not get the fluid back that you put in. What you'll do, because the actual neobladder is made of small intestine, so it can flop on top of the catheter tubing. So you may just want to unconnect the syringe and let the tube drain a little bit and then try to flush it again. Next, what you're going to want to do is you're going to want to clamp the catheter that's in your penis or your urethra, and then you're going to clamp that one and then repeat the process with this catheter.